My role at UMB is assistant professor within the School of Pharmacy, but I'm also director of the skills-based laboratory curriculum, what we call Abilities Lab. So Abilities Lab is skills-based learning. So it's inherently different than didactics or lecture-based curriculum in that, students are practicing hands-on skills that they need to become a practicing pharmacist. And the corresponding assessment that goes with that is also inherently different. We have made a concerted effort as a group across 3 years of the curriculum to coordinate our content. So we want to make sure that each year builds on the previous year and that the curriculum becomes increasingly complex and represents an adequate depth to prepare students not only for experiential rotations, but also for real-world practice. Abilities Lab 6 is the last course that occurs in this series. And what's unique about the course is that it occurs right before students go out on rotation. So right before they go out to their experiential component of the curriculum, which is the entire 4th year, this is the last course that gets them ready for that experience. Students are surveyed at the end of their 4th year as they're getting ready to graduate about the one specific question that they're asked is, what about the curriculum could be changed to make you better prepared to go out on rotation? And we had several years worth of data from students saying that there were things that they were unprepared for when they went out on rotation. And we took that information from the students directly and incorporated it into Abilities Lab 6. So for example, we incorporated a journal club. We had not currently covered that in a required course. So we gave them the experience so they at least had an example and a template to follow when they went out on rotation. Some other examples were presenting a patient to a preceptor. We have incorporated a longitudinal patient case to give students the flavor of what it feels like to see a patient on a rotation where they would be seeing that patient daily for a week or 2 weeks at a time. We do ours over the course of 4 weeks, and the patient changes. They go through various comorbidities and have different needs at different times, but there's a lot of knowledge and skills that we incorporate into that 4-week time frame. All of the changes that were made to the course that were fully implemented last year, and so this year the students have just completed that year-end survey, so I've had the opportunity to review those surveys. And interestingly, it says the same thing that it said before we made the changes to the course, except now it says we have one experience in Abilities Lab 6, and we need this integrated throughout the curriculum. We need to be doing this in every course.